let's talk about, Sarah, we've talked a lot about Safe Harbor wants to be the forerunner to talk about recovery language. When I first started talking about that, I had a couple of people say, oh, you're just trying to be politically correct. I'm like, no, I'm trying to save lives.
Yeah.
I'm trying to change the perception so that more people will come forward and get help. I want you in just a second to talk about some of that language, but I just want to read some of the outcomes if someone internalizes stigma. And here's some things to consider. Increase depression, coping through avoidance, socially and personally, decreased hope. If I'm stigmatized, if I say I am an addict, what hope do I have? Decreased self-esteem, increase in mental health and substance use struggles, decreased persistence in seeking help, and reduced self-efficacy. I probably said that wrong. But if we know this is what stigma causes, why would we not want to reduce stigma? And we can start right here in Hickory, North Carolina with Safe Harbor. So Sarah, what's some of the language that we can use to be pro-recovery, advocates?
Right. Well, we touched on substance abuser versus substance use early on. And we talked also about the word addiction. And moving from that word addiction to something like substance use disorder, when you throw the word disorder in there, I think it acknowledges that there is a medical component to this issue, and also because it recognizes that there is a medical component, it opens the door open for treatment, that this is a treatable disease.
Yes.
And also from a medical and healthcare standpoint, it becomes a billable service, right?
Yes, it does.
Right? It's not something that you have to go, it has to be hidden or that there's shame. It's you pay a copay, you get treated for it. Just as you were going to your primary care for any other health issue. And so, even if you think about, a dirty drug screen, are they clean or are they dirty? I've worked a lot within the court system and I want to take a moment to applaud our district of judges that have really, over the past few years, have immersed themselves in training and have been educated around this. And it's a completely different feel in the courtroom now than it was 10, 15 years ago. But even language that we used to use in the court system and then with probation, you see how even words like non-compliant, where they're just not complying, how about they just need a different intervention? If someone has type 2 diabetes and they go and have a conversation with their provider and their provider has recommended this medication regimen, this lifestyle change, this specific diet, and that person goes for a follow-up visit and they say, Doc, I haven't done a single thing. This is hard. Is the doctor going to say, I'm not treating you anymore. You failed. Get out of my office. What's he going to do? He's going to reassess and he's going to modify the intervention. And, I think, moving away again from addicted, alcoholic, my pet peeve is drunkard. It's substance use. Really, the emphasis becomes on the substance. What are we going to do about that instead of, she just can't get her act together. Well, he's just not trusting God. Well, again, we can it's so easy to pass judgment and to carry that stigma through when, you haven't really educated yourself. You don't have direct empathy with it. But again, in just working with people from a professional capacity, when you begin to introduce this language, especially when women, because, at Safe Harbor, there are lots of opportunities for our ladies to share their story. And since we've been introducing some of this pro-recovery language, even in their testimony and how they present it, their heads move from down to more confident, because again, we're that shame. God doesn't want any of his children to remain in shame. So why are we imposing that? It's so easy to do. You don't, if you don't know, you don't know. But guess what? We're enlightening you all now.
Yeah, we are shining the light.
So now you know.
And I think that in order to completely do away with stigma, which is going to be a very long and challenging battle, I think it all begins with education. Right. We have to educate people. We have to talk about it, because if we don't talk about it and we don't introduce things like recovery language and show people the correlation of this negative language and the effect that it has on people when they're already down and struggling, then we're not going to be able to make a change.